Good afternoon. My name is Lucian. I'm a student nurse anesthetist. How are you today?
I'm doing great, Lucian.
Okay. And could you please tell me your name?
My name's Rick Mortensen.
Okay. And what is your date of birth?
July 13th, 1954.
Okay. And what brings you over to us today?
Oh man, my asthma just acting up. I feel like I'm almost constantly short of breath.
I see. How long has this been going on for?
About a week and a half.
Okay. And when you feel your symptoms, do you feel them above your throat or below?
Oh, it's hard to say. It's kind of everywhere.
Kind of everywhere.
Boy.
Okay. Do you feel like you're able to take in a breath?
Yeah.
Okay. And how long did these symptoms last for?
Um, it's kind of there all day, but anytime I'm up and moving around, it gets so much worse.
Oh, okay. When you say you're getting up and moving around, what are you doing?
Gonna go fix myself a pot of coffee.
Oh, coffee is good.
Yeah.
Yeah. And do are there certain things that make it worse?
Well, usually my first cigarette in the day is okay, but by the end of the day, I just don't want to smoke anymore. That's weird.
I see. And do you smoke quite a bit?
I usually have 2 or 3 cigarettes a day.
All right. And you're saying that those generally make things worse?
Yeah,
Okay.
yeah, I know, I should quit, but
No worries. We'll get to that. Um, all right. Do you find any other things happening when you feel the symptoms? Do you get any body aches or headache, or do you feel dizzy?
no. I usually make it through my morning jog, but I just the whole time feel like I can't really get my breath all the way.
Are there things that make it better?
A nice warm shower is usually pretty nice. The steam feels good on my throat.
Oh, good. And you were saying that this is most of the day. Is it worse in the morning or at night?
No, it's most of the day. Most of the day.
And in terms of how uncomfortable or painful this is on a scale of 1 or 0 to 10, how would you describe that?
Um, it's usually sitting about a 2 until like I have those moments where it feels really tight, and it's about a 7 or 8.
Okay, I'm gonna ask you a little bit about the medication that you take. What medication do you take for this?
I got a little puffer that they said to use whenever it's getting really bad, so I use that, and it kind of helps.
Okay, and do you know the name of that?
It starts with an A. It's owl something.
Albuterol.
Yeah, that's the one.
Okay, and you said you take puffs,
Yeah.
right? About how many puffs do you take?
2 to 3. Sometimes it doesn't help though, so I'll do 2 to 3 more.
Okay, and does that help?
Yeah, it started to. It's getting worse and worse. So it's not really helping like it used to.
Okay, so before, were you just taking 2 or 3 and it would work, and now it's not?
Usually, yeah.
Okay,
That's why I've started doing some more if it doesn't work, and then now sometimes even that doesn't help.
I see. Do you take any other medication?
No, that's it. I'm usually been pretty healthy.
No, anything for blood pressure or blood thinning?
Oh, you know what? There is a couple other medications. I'm just so bad with remembering all of those. There's one that it ends with a weird sounding something. They said it's for my blood pressure.
Oh, okay.
It's
Lis-
Lisinopril. Yeah,
okay,
that's the name of it.
lisinopril. Good.
And then I always take one of those baby aspirins, but that's just, every morning.
Okay. And are you able to remember to take those meds daily?
Yeah, most of the time. I usually pop those right after my run in the morning.
Okay. And the lisinopril, do you know how much you take?
Oh man, I don't remember. I got my packet insert here if you want me to look for it.
No worries. Is it 5 or 10 or milligrams?
I think it's 10. That sounds familiar.
Okay, we'll go over that.
Okay.
Okay, and you said you take that once a day or?
Yeah, just once a day.
Okay. And the aspirin and the lisinopril, do you take those daily? You said?
I do, yeah.
And did you take them today?
I did, yes.
Okay.
Was,
And
was I not supposed to?
no, it's okay.
Okay.
That's fine. And the albuterol, when's the last time you used that?
Oh, about 20 minutes ago.
Oh, okay. Did it help?
A little bit, but not much.
All right, no worries. Um, okay. I'm gonna ask you a little bit about your past medical history. Have you been hospitalized?
No.
Do you have any surgical history?
Oh, I threw my shoulder out one time pitching for Son's Little League.
Okay.
So they did that, but it wasn't bad. I mean, I was in and out in the day. It was fine.
Did you have any side effects from the medication they gave you?
Whew, I felt loopy afterwards. The wife had to drive me home, but other than
I
that,
see.
I felt good.
Have you had any major childhood or adult diseases besides asthma?
No, not that I think. I don't really like going to the doctor so often.
All right. Did you have your shots? All your shots up to date?
Yeah, I got those.
Okay. Are you allergic to anything?
Not that I know of. Nope.
Okay. Do you get seasonal allergies or any medications that you can remember that you would have allergies to?
No.
Okay.
The only thing I'm allergic to is too much rest and relaxation.
I see.
I like to get the job done.
It's good. I'm going to ask you a few questions about your family history. Are your parents alive?
No, they both passed. Rest their heart.
Okay. Do you have any siblings?
I do. I got two little brothers.
Okay. And your brothers about what ages are they?
Oh, well, my youngest brother, he's 35, and my other brother's 38.
Okay. And how are they doing health-wise?
They're doing pretty good. Doing pretty good. Their mile times are terrible, but
I see. Do you have any children?
yeah. I've got one son and one daughter.
Okay. And how are they doing
They're
health-wise?
perfect. Healthy as a little ox and oxette.
Very nice. And about how old are they?
Oh, well, one's 12 and one's 14.
Okay, so no grandchildren then.
Better not be.
All right. I'm going to ask you a few questions about your personal history. How's your diet?
Diet's really good, really good.
What do you generally eat?
I'm a steak and potatoes type of guy.
Okay.
In the morning, I make sure to have a full breakfast with bacon, eggs, some pancakes sometimes if I'm feeling extra hungry, but usually just bacon and eggs.
And for dinner?
Dinner, I usually go with a nice Alaskan halibut or steak.
All right.
Steak, maybe a sirloin.
Do you use any tobacco besides the cigarettes?
Well, no, not really.
Any alcohol use?
Well, yeah, I've been known once and again to have a drink or two of whiskey, but that's about it.
About how often do you drink whiskey?
Oh man, New Year's was the last time, and what is it, midsummer now? So, not often.
Okay. And how many drinks would you say you had?
I stopped counting at 4.
Okay. All right. Any recreational drug use?
No, none of that stuff.
Okay. I'm going to ask you a few questions. Exercise. You said that you do a morning jog.
I do.
Okay. Is that daily?
That is every
And-
morning,
and
except the Lord's Day on Sunday.
I see. And about how long do you do that for?
Oh, I run a good 30-35 minutes.
30. Wow, that's quite a bit.
Yeah.
And how far do you get?
My goal is to complete at least a 5K, but then I usually do some sprints afterwards.
I see.
So that's just me running the rest of the block all the way home.
Have you been able to do this with your symptoms?
Oh, it's rough. It's rough.
Okay. Do you feel shortness of breath when you do this?
I do. That's why it's taking me so long. I used to do that in 20 minutes.
I see. Okay, I'm gonna just go over just the general head to toe questions. Do you have any fever, chills, or do you generally not feel yourself at this time?
No, I feel perfect.
Any,
Except for my chest.
except for your chest? Yeah. Any unintentional weight loss or or weight change in the last few weeks, months?
Nope.
Do you have any headaches, dizziness, or do you ever feel faint?
No, thank goodness not.
Do you have any difficulty swallowing? Any stiffness in the neck?
No.
No issues?
Nope, not that I
Any
can think of.
swelling around your neck?
Nope.
And you're able to move your neck freely, side to side, up and down?
Yep. Looks like it.
Good deal. Have you noticed any change in your vision? Any blurring, any double vision, any pain in your eyes?
Nope, thank goodness. Vision's still 20/20.
Do you use glasses?
I don't.
Very nice. Have you noticed any change in your hearing? Are you able to hear everything normally? Do you have any pain in your ears? Any discharge?
Ears are perfect.
Nothing is leaking.
Not that I'm aware of.
Okay. Do you ever lose your balance?
No.
Okay. Have you noticed any change in your sense of smell?
Nope, smells still pretty good.
Any cough, cold, or flu lately?
No, that's what I thought the shortness of breath was, but it just keeps going. So
What about any changes in your memory, or do you have any history of seizures or stroke?
no, not that I'm aware of.
Any history of concussion?
I don't. Nope, I never remember getting that.
Besides the asthma, do you feel any chest pain?
No, I don't think so.
Okay. Are you able to go up 2 flights of stairs without feeling discomfort in your chest?
Yep. I can get up to the second floor.
Do you have any swelling in your feet?
Nope.
Do you bruise or clot easily?
I don't know what that means, but I don't bruise.
You don't bruise? Okay. Are you do you ever notice that you have pain in your calves?
No, nothing new.
Nothing new?
Mm-mm.
You don't see one that's bigger than the other, right?
No.
Okay. I'm gonna ask you a few more questions about your breathing. You said you were feeling pain with taking in breaths.
Mm-hmm.
Okay. Do you find yourself short of breath?
Yeah.
Okay. What about, do you have a wheeze?
No.
When you take a deep breath, does it make any sound?
Oh yeah. There is a sound when I take a deep breath. That's what that's called?
Yeah.
Oh, okay. Yeah.
Yeah, sorry about that. What about you said cough?
Yeah, bad cough after I run.
Okay. And as far as you know, have you been exposed to tuberculosis?
Oh, not that I'm aware of, no.
Okay. And you said the albuterol doesn't help.
Not really anymore.
Okay. We'll look into that more. Have you noticed any change in your appetite?
Nope, still hungry as I ever been.
Okay. Are you able to go to the bathroom and defecate normally?
Yeah, everything's fine down there.
And same thing with urinating. Do you have any pain urinating?
No,
Do you find yourself waking up at night urinating more often?
no, not at all. What a silly question.
In terms of you're a person that takes a daily jog, but have you noticed any stiffness in your joints? Are you able to move freely?
Yeah, not as fast as I was when I was 21, but we're still doing pretty good.
And any muscle pain?
Nope.
Any swelling? Redness? No?
No.
What about in your chest area? Have you noticed any lumps or bumps?
You mean? No, I don't think so.
Any tenderness?
No.
Have you noticed anything leaking
Ooh,
around the
no.
nipple area?
No, thank goodness.
Good deal. Do you have any history of depression,
No, not at all.
anxiety,
Nope.
any thoughts of hurting yourself or others?
Oh man, only when I'm driving home from work. No, I'm just kidding. No, I don't.
Yeah, it can be frustrating. Do you sleep well at night?
I do.
Okay. All right. Well, that concludes our interview. We're gonna go into your symptoms about asthma a little bit more and just figure out how your medication can be adjusted. Okay.
Definitely.
All right. Have a great day.
Thank you. I appreciate that.